When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is highlights from our Going Integrative Plus community calls, where real people get to ask the top holistic cancer doctors in the world anything they want each and every week. Stick around to the end to find out how to be on these calls, asking the questions yourself. But in the meantime, enjoy and take something you can use right now from the show. Dr. Dagmara Beine, it's very good to see you again.
It's good to see you too. You don't age.
Neither. You got younger. You got younger.
And that's just the blur video effects that I can put on Zoom. This journey certainly adds wrinkles. If anybody has a good excuse for aging, it's the two of us. That's for sure. Yeah.
Dr. Dagmara Beine is not only an amazing practitioner, but she also understands what a family goes through, as her daughter Zuza was diagnosed with cancer and given a very poor prognosis at 3.5 years old. Having worked in emergency medicine for 12 years, Dagmara understood the value of Western medicine and how it could save her daughter's life. However, as her daughter moved through her treatment and recovery, she was shocked at how Western medicine failed to care for Zuza as a whole person. What do you know? She knew as a mother and clinician that she needed to incorporate other tools to guide Zuza through treatment and help her thrive as a cancer survivor. She is going to share with us today the tools she found and uses today in her practice, and share a sneak peek of the Integrative Guide to Pediatric Cancer book that will be launching this fall. That's incredibly exciting, Dagmara.
Yeah.
Good job. Any more elaboration you want to give on what all it is you do now, who you see, how you see them, all that good stuff?
Yeah. I, just like you, wish you would have had the service that you created when you were going through this. I was looking for any practitioner to help us on our journey that specialized in integrative pediatric oncology, and they were really hard to find. Same with books. There's a lot of really amazing integrative oncology books, but you don't find information on pediatric cancer in them, like neuroblastoma or Wilms tumor. Some cancers only exist in the pediatric world. And so over the last 7 years now, it's been since we've met, I have become the practitioner that I wanted and needed 7 years ago. So, went back to school and conferences, and I've been so blessed to have mentors like Dr. Nasha Winters and Paul Anderson and Neil McKinney. I've learned so much from them, and then nothing like being a cancer family and walking the walk teaches you how to do this the best way possible. And we opened our clinic. We have a local practice, so we have a brick and mortar, IV therapy, the works, but I have way more patients virtually. So I take care of kiddos across the world, mostly United States, but across the world as a consultant to help them sort of make the best decisions for their journey, help them with nutrition, try to get them on the best therapies, usually as a complement to their conventional oncology plan, because as we know, you can't really get away with, especially in the United States, not doing any conventional oncology. There's, different circumstances of ending therapy early, or if it's too toxic for your child. And then a lot of patients who've been told there's nothing else that can be done. And there often is a lot more that you can do. So I am on a journey to become the person that I needed 7 years ago for all these families. And I have found myself now through 2 relapses with Zuza, you know, we're still on our journey. So we're still walking the walk. And I've tried to balance that with also trying to help different families and have the clinic.
Yeah, I know all too well that it's things going backwards, and then you're trying to help other people, and that happened to us a couple times on the journey, and then we got and then our youngest son Rocky, the whole that was a surprise. A high grade eczema, looked like a burn victim head to toe. Well, I had to deal with that at the same time we were trying to help people, and so God bless you for sticking with it, Dagmara. You're doing the Lord's calling. I know that.
Yeah. I mean, I wish it wasn't, right? I wish this wasn't our journey, but it is. And there's so many families out there diagnosed every day that need guidance. That's why the book, and I literally started writing the book like when Zuza was inpatient going through transplant, and I just wrote and I wrote. And if you go to Amazon, this never happens with any topic. If you go to Amazon and you put in integrative pediatric oncology, what comes up? Nothing, right? You have like Paul Anderson's Out of the Box, and you have Nasha's Metabolic Approach to Cancer, but there's nothing that just talks about what to do for kiddos. And I'm not afraid to talk about all this stuff. And so it's going to be all in there, all the therapies that nobody wants to talk about, that you guys talk about, right? That should be applied to kids, not just adults, when we're going on this journey. So that's been my other baby through all this. It's been actually therapeutic being able to write and knowing that it'll help some families once it finally comes out.
Dagmara, the customary first question: when it comes to cancer, what are you thinking about? What's any kind of new breakthrough understanding you've had, or new treatment you're interested in, or new supplement, or whatever? Yep. What are you thinking about?
Yeah, so there's in sort of the family of mistletoe therapy, there's also something called Helleborus, which is a different plant. And there's a new type of Helleborus therapy that was discovered in Germany and started being used for specifically acute leukemia and myelodysplastic syndrome patients. And it's the only Helleborus therapy that looks like it's effective for acute leukemia. So that's sort of the newest exciting therapy, and Zuza gets to be the first patient. So we started doing injections of it's not a homeopathic, it's an extract from a plant. It's got anti-cancer properties. So that's kind of been the most exciting to see what kind of effect it has. And I have many adventurous pediatric patients with me that are willing to try this therapy. So that's sort of the newest and greatest coming out from like cancer therapies. Helleborus. It's called Helleborus fatidius.
So Helleborus. And so that's a different type. I know somebody has just mentioned this on a call, and I'm trying to place where I just heard it. But it's a newer type of mistletoe extract that's not,
nope.
Or just.
It's not mistletoe, but it's like mistletoe.
It's like mistletoe.
Yep, it's a different plant. So mistletoe is a plant in itself. Helleborus is a different plant, but they have discovered in the Helleborus family, a specific Helleborus that more than ever looks to be potentially effective against acute leukemia. And you can only give it IV or subcutaneous. And obviously subcutaneous is the easy way. So there's a couple doctors in Switzerland and Germany that have started using it subcutaneously on adult patients. And then I've started using it on pediatric patients.
And so how are they determining that just through
lab
cell studies and stuff like that, or?
Yep. Small studies right now, and mostly, the easy thing about leukemia is that you can do a simple blood draw. If there's active disease, you can actually tell if something's effective by the lab, the way the labs look. And so they've had some good initial results in Switzerland and Germany based off of this.
Well, yeah, I guess that would be easier because it's right there in the blood. You don't have to guess at what's going on in the tumor.
Right. You don't have to, worry about overscanning or the way you're scanning or the contrast or all that stuff that you have to worry about with solid tumors.
Yeah. I was just on a call the other day and talking about something about colon cancer came up, and we were joking that, at least the one silver lining there would be you can just, whatever you want to expose the tumor to, you just stick it up there and let it do its thing.
So, just a comment about colon cancer. I have found in my practice with adults that colon cancer, more than any other cancer that I've worked with, this is just my experience, stage 3 and 4 responds the most to just integrative therapies. And there's a new study that hasn't been published yet out of Australia, that actually just a conventional oncologist that I'm friends with told me about a couple weeks ago, that compared stage 3 colon cancer chemo to stage 3 colon cancer only lifestyle changes, and it was the same. So that is like amazing to know that stage 3 and 4 colon cancers, and I see this in my practice, really there's only hope for lifestyle, integrative nutrition. For me, in my experience, more than any other cancer I've seen in adults.
Yeah. Good to know.
Yeah.
Very good to know. I guess this is more of a comment, but my 6-month-old granddaughter looks like has neuroblastoma, getting diagnostics done yesterday and today, trying to get my son interested in a more integrated approach. It's either the grandparents reaching out about their kids and wishing their kids would look into more of the stuff that for their grandkids have cancer, and they're trying to get their kids to actually do the integrative stuff, and they can't do it. Or it's a wife and a husband, and 93% of the time it's the wife wanting to go the integrative route, and the husband saying, no, we're listening to the doctors.
Yep.
So
that is a hard one. I think I've learned over time. It is definitely not my place as a practitioner to convince anybody of anything. And it's heartbreaking at the same time. I agree with you, Ryan. I have so many situations where I'll even bend backwards and see a patient on a Sunday because they're about to start chemo. And I'm like, we got to get all this stuff in order. And then sometimes the response is, well, thanks, but my husband doesn't agree with anything. So you can show them the data. Nothing that we're speaking about isn't scientific. Nothing that we're speaking about doesn't have really good data. But past that, that we're just made differently. And sometimes people over time change and sometimes they don't. And it's heartbreaking.
Neuroblastoma is one of the more well-studied cancers, especially in studying things in relation to, different herbs, supplements, treatments, et cetera, et cetera. I mean, you could, anything you hear about or read about in the integrative cancer world, you can hop onto PubMed and type in, genistein
and
in combination with neuroblastoma, and you'll find that genistein is one of the few things that maybe that's the main thing I found, that high risk neuroblastoma kids actually have to get to high risk, one of the factors could be an NMIC amplification. It's a gene type of thing. The conventional world will tell you that there's nothing you can do about this amplification. All you can do is just destroy every last cell and hope that the chemo kills the cancer before it kills your kid, that sort of thing. Yeah, genistein, that's one of the few studies I found that shows it'll actually lessen that NMIC amplification. So, and that's from soy, among the flax seeds, that sort of thing. So our favorite products, healing, for genistein. So I don't know. Yeah. Maybe that's something you can throw at them, just study after study after study.
Yeah.
In your perspective, what is the most I like this question, underappreciated integrative strategy you find value in? Underappreciated even in the integrative community?
Two things. One, the impact. This is slightly more for adults, but it depends on the situation. The positive impact of fasting through IV chemotherapy or radiation, reducing side effects of that treatment by 80% and protecting our healthy cells. And number two, the importance of gut healing post-conventional treatment. We just, even in the integrative world, we forget how important it is. We talk about that a gut gets ruined when we take an antibiotic. Think about what it does when you have had chemo, radiation. I mean, the whole works. So just the need to be adamant about putting in all the good bacteria, the sauerkraut, the broccoli sprouts, the repair complex, the digestive enzyme, in order for these kids to be able to heal, both to reduce late effects, which up to 95% of pediatric cancer kiddos have from treatment, and in the chance that a child's cancer comes back, that they are strong enough to be able to go through more treatment.
Another interesting question. If it were legal, would you have gone 100% integrative for your daughter? And I assume by integrative, he means, integrative is kind of Western and Eastern, or, conventional and alternative, blah, blah, blah. But I assume he's saying, just holistic, natural, alternative, et cetera, et cetera.
I think this answer is going to surprise everybody. I have learned over the last 7 years, in my experience, that acute leukemia, so AML, ALL, I'm not talking about chronic leukemia or the one in adults, is really hard to put into remission without chemotherapy. I have had a chance with Zuza when her cancer came back. I didn't tell the conventional oncology world, and I did do everything. I did have an opportunity to do everything, and it didn't work. So in an acute myeloid leukemia case and in an ALL case, I feel that chemotherapy at least needs to be used initially to get the child into remission. Now, would I still want to end treatment early and do it differently and support it and use other therapies? Absolutely. But specifically just for acute pediatric leukemia, I feel that you need chemotherapy. I don't feel that way about many other cancers, but I do about acute leukemia.
Yeah, I mean, even looking back on everything we went through, the tumor in Ryder's spine it's amazing it hadn't already paralyzed or killed him. And I still to this day don't know of anything that, I could bank on saying, and the alternative side saying, that this will shrink the tumor in time. But then when they wanted to keep going with it and we're like, nah, I think he's good. That's when we had to move states and find a new team and all that good stuff. Yeah. What treatments work on colon cancer? So maybe again, what's you already brought up colon cancer, Dagmara, but anything in particular that jumps out to you?
Absolutely. So in my experience with colon cancer, the biggest impact that you can make is nutrition. And while I feel that nutrition needs to be a big change in all cancers, not more than in any other situation than colon cancer.
Makes sense.
Nutrition, toxins. The other thing that I find a lot for colon cancer is most people are full, if you do testing, glyphosate and other environmental toxins. So like detox, sauna, good binders. And I love for colon cancer, so nutrition, detoxing, finding out what you need to detoxing. And I absolutely love for colon cancer, mistletoe. There's a lot of really great examples of people, including the organizer and CEO of Believe Big, who had stage 3 colon cancer and used nutrition, key supplements that are individualized for that person. And mistletoe, I think, is a big one for colon cancer. There's different types of mistletoe, so a specific type of mistletoe for colon cancer.
Offhand, which type?
Mistletoe M, Molly.
M.
Yep.
There you go. Following up on the colon cancer question where you mentioned, diet, nutrition, the biggest important thing. Could you expound on that? What is the optimal anti-colon cancer nutrition in your view, Dagmar?
Yeah. So, in my experience, I have used for most of my colon patients, obviously eliminating all processed foods, bad oils, tons of veggies, low or no grain, lots of healthy fats, like a foundational real diet. Yes, some green juicing, bone broths, really also looking at what the patient is malnourished in, looking at their ratios of their omegas and what they need, and optimizing, again, individualizing for them what they need. So again, even nutrition comes down to I don't use one diet for everybody. I don't prescribe, everybody go vegan or everybody go into ketosis. It's just really individualized for what's going on with that individual at the moment.
Or a vegan keto.
Or vegan keto. It's like the most confusing world nowadays. Alone, yeah. Just alone in the world, what to eat. And then when you get cancer, you could read, an argument for vegan and an argument for ketosis. And it just needs to be individualized to you, what you're going through, why you got it, what your epigenetics show you need.
Any thoughts on bladder cancer?
Yeah. I have actually, for bladder cancer, used ozone as a treatment. So that's one thing that I would definitely look into. I'm pretty sure if you go to PubMed, how do you do it?
Well, are you talking 10 pass or rectal or?
No. So not 10 pass. I mean, we do 10 pass in my clinic, and I don't think of 10 pass in cancer. It can help you feel better. I don't think of it as an anti-cancer treatment. But actual injections of ozone into the bladder.
Oh, into the bladder.
Yeah.
I didn't know that was a thing.
Yeah. You can actually go suprapubically. You want to know your anatomy and you can inject ozone. So that, and I'm pretty sure if you PubMed, there's a couple good studies for that. There's practitioners all over. If you want to find a good ozone practitioner, if you go to Dr. Robert Rowan's website, he has a list of everybody he's trained. So that's a good place to start looking for an ozone practitioner. But that's sort of what popped in my head when I think of bladder cancer.
Pediatric question. Any thoughts on pediatric osteosarcoma?
Yes, I'm so glad you asked. The only big study for pediatric oncology is with osteosarcoma. So they took kids who had relapsed osteosarcoma, and half of them they gave chemo, etoposide, and the other half they did only mistletoe. And 5 years later, 100% of the kids who got chemo died, and 56% of the kids who got only mistletoe were in remission. That is huge, because you can also do mistletoe with chemotherapy. And so if I get any osteosarcoma patients, I like for them to do subcutaneous, and if they're local or if they're willing to fly in, then we also do IV, mistletoe for osteosarcoma. And we have a beautiful study to show our conventional oncologist. And they're curious. I found that I have more with that study. I have lots of different interactions with conventional oncologists, and I speak to many of them for my parents. But they are much more open to mistletoe use with their patients after this study.
That's good to know. Could you send that study?
Yeah.
To me, Dagmara?
Yeah.
We'll post that in Post that in the download section for the replay
Yep.
here, or at least
Yep.
the link or whatever.
Yeah, it's phenomenal because nothing relapsed osteosarcoma does not have a good prognosis, and mistletoe, which has no bad side effects, can make a huge impact. And so so there's an umbrella, right? There's osteosarcoma, rhabdomyosarcoma. There's all these different sarcomas. I've sort of really ran with the mistletoe for that umbrella of cancers for kids.
Very good. Very good. Yeah, speaking of sticking things in the butt for rectal cancer and or for ozone, for colon cancer and ozone, Erica, good question. What about rectal ozone for colon cancer?
Absolutely. You just want to make sure, if you have open lesions, basically you just want to make sure that you're not sticking something where there's an open wound and you get it infected. But yes, ozone is phenomenal. Rectal ozone is actually phenomenal for all of us. It's great at gut healing. It's just, everybody should have an ozone machine at home. If your kid gets an ear infection, it's the easiest way to get rid of it. But 100% gut healing or rectal cancers, or people who can't do a 10 pass at our clinic, we'll recommend rectal ozone with a home machine.
Any thoughts on prostate cancer?
Yeah. So prostate cancer actually has one of the biggest conventional oncology studies out there because it's such a slow growing cancer. Even conventional oncologists felt safe enough to be able to compare men and say, half of you guys get treatment and the other half of you guys do lifestyle. And so it's one of the only cancers out there that was tested this way. And lifestyle won. So lifestyle modifications are huge for pediatric cancer. You can go so far with just eating while moving. I find another thing with prostate cancer is there's usually some kind of, how do I word this? There's usually some kind of a issue, maybe with sexuality. So like moving our hips, doing like a hula hoop is really important for men who have prostate cancer, just to sort of like open the area up. I have done ozone injections into the prostate. Ouch. I know it sounds terrible. But that's another area where I utilize ozone. High dose vitamin C, I think of when I think of prostate cancer, and not ketosis. For prostate cancer, I think, low carb, nutrient dense, tons of veggies, but not somebody that I would ever like pull into a deep ketosis unless they were like getting radiated that week or whatever.
What is the best way to heal a gut pummeled by 3 years of antibiotics, not to mention chemo?
Yeah. So gut healing, it's one of those things that it actually is a protocol you can follow. Now, can it and should it be individualized by testing what's going on in your gut? Yes. But I never do testing on a gut of a kid who just finished chemo because I know it's ruined. I never like to do testing unless it's going to change what I'm going to do. I hate to have people spend money if I'm still just going to gut heal. So I do gut healing on a child for at least a year before I do any type of testing because I know it's going to take minimally a year or more for that gut to show good bacteria and not bad bacteria and the right stuff. Gut healing. So you can find a protocol out there, but it's the 5 R's. And I always forget this. So we want to remove. This is the hardest part for everybody. So remove means we want to take out all the crappy stuff out of your diet, because if you're eating a whole bunch of gluten and canola oil and processed sugar, no matter how many supplements you take, you're not going to heal a gut. So the kids got to have a good diet when they're done with treatment. Hopefully they had a good diet through treatment, but they have to have a really good diet for the rest of their life. But let's just say a year. Lots of probiotic rich foods, broccoli sprouts, prebiotics, probiotics, those types of things. But that's remove. Sometimes part of remove also means we need to take a supplement that removes bad bacteria. So my favorite ones are Candibactin AR and Candibactin BR. Those are supplements I like to use for adults, and Biocidin for kiddos because it's a liquid and doesn't taste bad. Then you want to re-inoculate. What does that mean? You want to put all the good stuff back in your gut. So you want to eat lots of probiotic rich foods and you want to take a quality probiotic. When you take a quality probiotic, you want to switch it out every 2-3 months because we have all these different bacteria in our gut. We don't want to always keep giving our gut the same ones. And there's lots of good probiotics out there. Then we want to restore. That means we've lost the ability to digest our food. And if we don't digest our food, we're not going to be able to absorb it. So a good digestive enzyme or apple cider vinegar or bitters to help break down our food. And then the last part, which most people forget about, is repair. So we need to repair the lining of our gut where absorption takes place that was ruined by chemo or radiation or antibiotics or ibuprofen or Tylenol or stress. And so there's a list of maybe 15 repair complexes that can heal the lining of your gut. There's a couple companies that have put those together. GI Revive is a great one. RF by Integrative Therapeutics. But just to name a few repair complexes on their own. Omega-3s, zinc carnosine, slippery elm, marshmallow root. And then my favorite, because it does a lot of things, is full spectrum hemp oil. It can heal the lining of your gut, help you fall asleep, help your anxiety, just the whole endocannabinoid system. So that's how you heal a gut. So the hard part is sticking to a really good diet. The easy part is taking those supplements. And every time you run out of a probiotic or you run out of a digestive enzyme or you run out of a repair complex, you want to switch to a different one because you don't know exactly if it's going to be marshmallow root or slippery elm that's going to be that thing that heals your gut. So you want to give your body an opportunity with different things.
What do you use for emotional healing for cancer?
For me or for my kid? Okay.
Yeah, that's actually felt like, that actually drove me crazy when I was going through cancer with a 1-year-old and everyone's talking about you got to meditate and do your shadow work and release your like how am I supposed to apply this all this to a 1-year-old? But yeah, no, but I mean, maybe 2-part question. What do you have adult cancer patients do, and then how do you guide parents and families through emotional stuff? For their kids.
Yeah, so for kids, it's actually a lot harder. Every single person who gets diagnosed with cancer, there's an emotional component that contributed to it. It can be a big piece or it can be a tiny piece, but there was something. For adults, it's easy. We've all been through some kind of trauma in our life. There isn't an adult that I don't talk to that tells me they didn't get diagnosed with cancer where 2 to 3 years beforehand didn't have something, right? So we want to find a therapy that we resonate with. So there isn't a better therapy. I mean, there's talk therapy, there is meditating, there is body work, you just have to pick something that you resonate with. For kids, I think it's harder. It's harder to think, why did my 3.5, what was wrong emotionally with my 3.5-year-old that helped contribute to her cancer? For kids, I think outside time, nature. I can't stress that enough. Allowing them to be kids, not trying to make them fit into the messed up school system. Laughter. For me, I mean, my gosh, I don't know. I'm still on a healing journey. I didn't try to heal after Zuza was diagnosed 7 years ago. And then she relapsed and I realized how much I didn't heal. I just wanted things to be normal and they never are. They're a new normal and it can be beautiful. So what I found personally, prayer, meditation, there's a lot of really beautiful research right now on psilocybin and microdosing. I love hemp oil. I think that is very individualized and you have to explore. For you, a meditation may be doing pottery or painting. For me, a meditation may be sitting in my sauna. That is very individualized, but we all have to have something that we do every day that we look forward to that helps us. In kids, we just have to give them the opportunity to be in nature, not be rushed, not be scheduled, not be enclosed in a room all day for 7 hours with artificial light and toxic carpet. That's my answer.
It's a good one. Yeah, I think just the intention to, the strong intention and will to heal emotionally, and then there's all the different things you just listed, but it's trying, just having that will, having that determination to do it, and then trying all the things you hear about and figuring out what resonates with you, or what few things resonate with you, and making it part of the everyday thing. That's I'm really big on morning routines for that reason, that you get all that woo woo emotional stuff and just knock it out first thing.
Yeah, I think it's probably the hardest part of a cancer journey is the emotional stuff.
Is there anything that can be done to improve low neutropenia levels?
Yeah. So my two favorite tools for that, one, low dose naltrexone. I love low dose naltrexone. I have probably that's the one thing across the board I can say I have almost every single one of my patients on a cancer journey on, because overall in studies, it just helps. Now, there are certain chemotherapies that it helps crazy, like cisplatins. If you're on a cisplatin chemo, you need to be on low dose naltrexone. It makes it work better. But just in general, low dose naltrexone it's an immune modulator. Immune modulator doesn't mean it stimulates your immune system. It doesn't mean it suppresses it. It just goes in there and it makes it smarter. And you got diagnosed with cancer, your immune system isn't that smart. It needs help. So low dose naltrexone, inexpensive, really low side effects profile, no brainer. The second thing that I like to have my patients on to help prevent neutropenia or help prevent how long we're neutropenic for is mistletoe. So I love mistletoe for that reason. Mistletoe in studies goes in, makes your T cells better. And we can actually, after 6 weeks of therapy on mistletoe on your CBC, see that it's doing the work on your immune system.
Should you pulse LDN? And if so, how to pulse?
Yes. So for cancer, LDN should be pulsed. So my protocol for kids and adults is to start them at a low dose and over weeks to months build them up. To little kiddos, I won't work up to 4.5 milligrams. It depends. But most adults you want to get up to 4.5 milligrams. Once you've been on 4.5 milligrams for a week, then you want to pulse it 4 days on, 3 days off.
If you could add any treatment to your practice, but haven't yet due to legal issues or other reasons, what would it be?
Hyperthermia.
Like so, the actual
hyperthermia.
Yeah.
Yeah. So hyperthermia, it's not available in this country. And it can be really effective for reducing the size of a tumor, effectively, kind of like radiation or chemo. So whole body hyperthermia or localized hyperthermia, but it has to be done in a hospital-like environment, in case, something goes wrong. So it's not something a clinic like mine could even try to do. So that is the one treatment that I wish that we had access to, that I sometimes will send my patients to, Germany for.
We had Dr. Sharon Germ on a few weeks back, and she was also on one of our online events, on one of our anti-cancer revolution events. She has it in Canada. Is it possible to get ahead in detoxing the body from glyphosate when living in farm country?
Oh, glyphosate. I could talk about this forever. I think glyphosate is a big cause of my daughter's cancer, so I have dove into this deeply. You have to move, which is not what you want to hear. So glyphosate is water soluble. So it's actually fairly easy to detox because it's water soluble. It's not a fat soluble toxin. And so getting in a sauna, and I found only one binder I found that worked for my kids and then most of my patients, which is the Cellcore HMET binder. But if you get a sauna and you get the binder, you have to do that every day until you move, because you're constantly being exposed to it. Like, you actually have to stop the exposure to properly detox. Otherwise, it's just this ongoing cycle. And some of us, epigenetically, why can somebody live on a farm and spray glyphosate off their tractor and never get cancer, and another kiddo get, relapses 2 times, and most likely glyphosate being a big contributor? So we have a pathway called PON1, PON1. And if your PON1 pathway is working great, you are able to detox glyphosate. What I have found by testing so many kids is that many kids who get diagnosed with certain types of cancers, leukemia being one of them, they have their SNP, their epigenetic SNP, the PON1 isn't working effectively, and they're not able to detox glyphosate. They absorb it 248% more. This is a study. That's why I know that very particular percentage.
Wow.
And the one thing that can make a dramatic difference for them in helping that PON1 pathway is by taking quercetin. How simple? Quercetin. And quercetin is found in the skin and peels of fruits and veggies. So also eating lots of fruits and vegetables is key. So unfortunately, I'm telling you the answer you don't want to hear. You have to move. But the way to detox glyphosate is sauna, binder, sauerkraut juice. Those are my top 3.
Good question. Is there an available resource to patients to determine interactions between meds and herbs / supplements, or certain cancers and herbs that might be contraindicated?
The resources that are often used, like if you bring your oncologist a list of supplements and herbs you want to take, they use their inpatient pharmacist will run it through a database. And it will tell us 98% of what I want the patient to take is contraindicated. And so I don't trust that stuff. In fact, I just did it with Zuza 2 years ago to show everybody. I'm not going to listen to what the team tells me not to give her. I gave them a list, and then they actually wrote back all the reasons why she can't take what I wanted her to take, and she did take through transplant. And the reasons are like crazy, silly, like vitamin D can be toxic because it might have a heavy metal. Like, it's just like the reason that they come up with, and they're giving your child like the most crazy, toxic, sometimes necessary and life-saving treatment. So there isn't one that I trust. What do I trust? I trust the experience of my mentors. Neil McKinney's book is phenomenal. And any conference or anything I've ever been able to get from him, he has a lot of knowledge that he's retired now, but that he has passed on in his books. In my experience and the experience of my mentors and the experience of their mentors, of knowing that you can give what's like one that I've always been told never to do. You can give quercetin with certain chemotherapies. You can use omega-3 and should through chemotherapy. You can, I'm trying to think of all the things I've been told not to do. You can do high dose vitamin C the same week you get high chemo, because it goes from being an antioxidant to an oxidant therapy when it becomes high dose. Like, so I don't use a resource, and I haven't found one that I trust. I use more of like my mentors, and there's lots of really great naturopathic oncology books that have that information.
Yeah. You mentioned Dr. Neil McKinney's book, Naturopathic Oncology. Just make sure to get the latest edition.
Yep.
And it's that's phenomenal. And and he does talk about, like, there are a few things that you wouldn't want to take with this or that. And you can trust Dr. McKinney because he's got decades of experience. What else? Dr. Lise Alschuler's book, The Definitive Guide to Cancer. She's got a pretty good spreadsheet. It goes over a few pages in there as well. Possible interactions we wouldn't want to be messing with. Diet recommendations for brain cancer, oligodendroglioma.
Glioma ketosis. We have enough studies to know that absolutely 100% therapeutic ketosis with. So there's a difference between nutritional and a therapeutic ketosis. Therapeutic ketosis is more of a metabolic therapy where you need to go much deeper. Your levels when you do blood glucose and ketone monitoring are going to be much higher on the ketones. And you usually need to utilize lots of healthy fats and even exogenous ketones, but 100% therapeutic ketosis.
And that being said, you can still get lots of plants on a keto diet.
Oh, absolutely. I mean, tons. You want all the veggies.
I like Dr. Will Cole's Ketotarian book.
Yep.
If you're going to go that route, really helpful. And you don't have to just eat bacon and sour cream bombs all day.
No, I think there's a very, I think it's very unfortunate that there was this explosion of a keto diet in this country. And I feel like anytime anything explodes in America, it just sort of gets ruined. So it's like
Americanize it. Yep.
It's been Americanized. So Diet Cokes and McDonald's burgers without buns. We are talking about a completely different metabolic therapy when it comes to cancer.
What are your thoughts on hyperbaric?
So I have been taught, actually from Nasha Winters, Dr. Nasha Winters, hyperbaric should only be done if there's active disease in ketosis. Otherwise, it potentially could be harmful. I use hyperbaric in my patients with DCA, poly, and VA. So that's part of the protocol is hyperbaric. Now, if there's no active disease, for healing, graft versus host disease, healing post-treatment, hyperbaric is phenomenal.
So Dr. Nasha says that, that's a new one to me, that hyperbaric could be harmful in active cancer situations, not in ketosis.
Yep. What's
the logic there?
Just as an oxidative therapy that it can with certain cancers. And there is a small study, it can promote the growth of the cancer versus what we're trying to do.
Do you work with people that do RGCZ testing for CTCs, beginning of cancer and no known tumor? Some indication of cancer, but can't find it necessarily.
Yeah. I used to use the RGCC test in my practice, and I don't use it anymore as part of my practice.
It's a good answer. That's the more common answer than the not.
Yeah.
Dagmara, this has been awesome. Give us the rundown, the website, how to work with you, the book, anything else you're working on, all that good stuff.
Yep. You can find me at zuzasway.com. Calling the practice to make an appointment is the easiest way to have your questions answered and make an initial consultation, whether that's in person or all virtual. And we do have other practitioners in my practice as well, because I tend to book out a little bit. The book is going to be the first integrative guide for pediatric cancer, written for a parent to take their child through a diagnosis, relapse, or healing post-treatment, and all the different steps that are necessary for that. And also coming will be a retreat center on our farm, a very small 3-bedroom, non-toxic, worked with the Green Design Center, Andy, to create a farmhouse that we will open retreats to for adults and pediatric cancer in different stages of their healing. And you can just follow information on our website or social media, Instagram, Facebook, or my website.
And again, this episode was highlights from one of our Going Integrative Plus Q&A calls, where we get a top holistic cancer doctor on a call once a week, and our members get to ask whatever it is they're currently trying to figure out. If you would like to hear the rest of the 2-hour call, along with over 100 other calls we've done, along with the recordings, notes, and slides from our entire first and second Anti-Cancer Revolution online conference events, and most importantly, the ability to ask the doctors and healers featured on our events and community calls anything you want yourself directly. That's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week, we get one of the top holistic and integrative cancer doctors on a call, and you get to ask them anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. Again, you also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, time-stamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And always remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.